สวัสดีครับสวัสดีครับเดี๋ยวรอสวัสดีครับทุกท่านไม่ได้ Facebook Live มานานวันนี้อยากจะมา Facebook Live แล้วเซฮัลโหลทุกท่านนะครับไม่ได้ทำ Facebook Live หรือไม่ได้ทำวิดีโอเป็นภาษาอังกฤษมานานแล้วเพราะฉะนั้นวันนี้จะทำเป็นภาษาอังกฤษสักแบบหนึ่งนะครับso we're going to do Facebook Live in English today because I think we haven't done an English video for a while. Hello sir, how are you? Hello. So we're going to do the Facebook Live in English today, and it's very hot in Thailand right now, so I hope everybody is staying hydrated. I think it's entering rainy season now, right, in Thailand, but it's still hot. So stay hydrated. So I'm drinking from a CMC cup, so that's gonna keep me hydrated for sure. Alright, so we're waiting for some more people to come. And by the way, it's one of my very good friends' birthday today, so I want to give him a shout out. Happy birthday, Ben. Ben lives in New Zealand, so happy birthday, Ben. I want to say that you is the man. By the way, that's wrong English. We shouldn't be teaching incorrect English. So you are the man, but for some reason these days it's so cool to use wrong tense. So we all say you is the man for fun. But happy birthday, Ben. We'll see you soon. Hopefully we'll get some tiger beer. Okay, so today I want to talk a little bit about my diagram here that I drew a couple of days back, and I was teaching, tutoring some medical students about this, about unhappy triad and anatomy, and so before anything, let me orient you on my horrible diagram. And I know my diagram needs a lot of work. I need to practice my art, but this is supposed to be the knee joint, right? This is the knee joint. So this is the femur. This is the femur, and this is the tibia. Femur, tibia, and this is the fibula, right? And this is the lateral side, and this is the medial side. So medial side, lateral side, femur, tibia, fibula, and we're going to talk about some ligaments today too. This is the anterior cruciate ligament, ACL, right here. And behind the ACL is PCL, posterior, right? Posterior cruciate ligament behind. And you have the medial collateral ligament here. And the ligaments are in the purple. Today the ligaments like the superstar, right? And ligaments is fibrous connective tissue that connects bone to bone. Usually the ligaments keeps the joint stable, right? So the ligaments keep the joint stable, and usually the knee stability of the knee is very important, right? Like especially when you play sports, you have to like trust your knee to plant your knee down and make the cuts, right? Like football. Like in football, when you get the ball, you try to make the defense miss you. You make the cuts and stuff like that. You want to make the defense miss you. So you want to trust your knee when you make sharp cuts, like Ronaldo in soccer. When he runs and make the sharp cuts. This is the lateral collateral ligament, and in the green here we have the meniscus. The meniscus, actually, I drew superior view right here. So in this view right here, it's like you cut off the top, you cut off the femur, and you're looking at the top down. So that's superior view. And this is the medial side. So this is the medial meniscus, and over here lateral meniscus. This is the lateral meniscus. So the medial meniscus is like a semicircle, and the lateral meniscus is almost like a circle here. So the meniscus is like tough fibrocartilage. tough fibrocartilage, and that's like gonna be like protecting you when you fall, when you jump and stuff like that. It's like shock absorber, right? And and you know the topic I had in mind today is called the unhappy triad. And when you think of the knee, actually, in a test, especially like the USMLE, you know, big exams like that, when you test about the knee, like normally, one of the most common thing that we see is like is something called osteoarthritis, right? Everybody's heard of osteoarthritis. When you're older, you get osteoarthritis. You know, it's like the wear entire joint, where the articular cartilage wears down. Usually, somebody who's like overweight will get osteoarthritis when they're older. So in osteoarthritis, the articular cartilage, so between the joint, there's two cartilage, there's two joints like this, right? And to prevent the joint from rubbing like this, you have the articular cartilage, which I actually forgot to draw that. So the articular cartilage would be like that, somewhere like here, in the pink like that. So basically that prevents the femur and the tibia from rubbing against each other. And when you get older, or when somebody who's overweight, a lot of like weight will come bearing down onto this joint, and the cartilage over here, the articular cartilage, will wear down, causing the bone to grind, causing your femur and your tibia to grind against each other, and that's going to cause a lot of like injury to the bone and pain as well. There's nerve endings. There's a lot of nerve endings between these two bones. So that's osteoarthritis, and you see that in older people. But today we're going to talk about sports injury, right? And usually you see something like this on the USMLE about the knee. If it's a sports injury, usually you see like a vignette about a football player. A football player, you know, he's running, he's planting his knees, and he gets hit from the side. He gets hit from the lateral side, and then he has a knee pain. He has a knee pain, and usually that's the vignette for the unhappy triad. And the unhappy triad, I know that sounds exciting. Unhappy triad, what do you think about it? When you hear about the triad, you think about the Chinese movie, right? Like Kung Fu, Rush Hour 3 or something like that, unhappy triad. But it's not. So I hate to disappoint you, but unhappy triad talks about the three structure that you get injured when you have a sports injury, you know, like a football player get hit from the side, the lateral side of the knee, you get injury on the medial meniscus, on the medial collateral ligament, and on the anterior cruciate ligament on the ACL. So three injuries, and that's going to cause a lot of trouble because it's going to cause your knee to slip around a lot, forward, backwards, when you play sports, and that's not very good because you need to trust your knee. You need to trust your knee when you play sport and you make the cuts, right? So let me go through each ligaments, and then you understand more what the unhappy triad is. And as I said, the ligaments of the knee, and ligaments are fibrous connective tissue that connects the bone together to make the joints stable, so to stabilize the joints, right? So here you have the ACL, right? So you see in front here, ACL. So ACL is anterior cruciate ligament. So the original point of ACL starts from the anterior intercondylar right here on your tibia, and it goes, the causeway goes superior, posterior, and lateral, and it connects to the the lateral femoral condyle, right? So that's the anterior, so that's the ACL. And the main job of the ACL is to prevent the tibia bone from slipping forward, right? So it prevents the displacement, the anterior displacement of the tibia. So it doesn't make you, so it prevents your tibia from slipping forward. In other words, it prevents posterior displacement of your femur. So that keeps the anterior and so that keeps the tibia and the femur bone like in place, and it's very important. So that's the ACL, and also it prevents hyperextension of your knee. So your knee right here, right? This is flexion of your knee, and this is extension of your knee. So it prevents hyperextension of your knee. That's the ACL. So the PCL, posterior cruciate ligament, it starts from the posterior intercondylar on your tibia, and it goes anterior, superior, and medially, and it attaches on your femur, attaches on the medial condyle of the femur, right? And this one prevents the tibia from slipping backwards, right? So prevents the anterior displacement of your femur. So these two things prevents like your femur and tibia from like going forwards and backwards. So basically ACL prevents your tibia from slipping forward. Your PCL prevents your tibia from slipping backwards. And as I said, that's so important, right, in sports, because when you're running around in a rugby field or a soccer field, you have to make sure that these two joints are in place. You have to trust your knees to make the necessary cuts in sports when you run around. So so that's very important. And usually when you get injury to the ACL, PCL, is when the athletes plant their knees, right, and they hit, you know, and their knees are twisted. When your knees are twisted, that's when you most likely to have a tear in your ACL or your PCL, right? Okay, so we got these two down. The ACL prevents tibia from slipping forward. The PCL prevents your tibia from slipping backwards. Okay, and do you guys remember the draw sign in physical therapy, in physical diagnostic? When you do physical diagnostic on a patient who have had a sport injury, you do something called draw a sign, right? Do you remember that? So that's when you check the patient's ACL and PCL, right? The patient just had a sports injury, right? Somebody tackled the patient and they're having like some, the knee is very swollen, the knee is very stiff, the knee hurts a lot, and so you want to do a draw sign, and that's when you have a patient lie flat, right? Lie flatten their back, supine, and you have they're gonna flex their hips a little bit, 45 degrees, and they're gonna put their knees 90 degrees. So the knees are 90 degrees, their feet are flat, right? And then you're gonna gently pull, and then you're gonna gently pull forward on the tibia. You can pull that forward, and that's positive. If that's a positive draw sign, then the tibia will move forward a little bit, and that could be that the patient has an ACL injury, and also you can test the PCL too. You can push the tibia forward a little bit, and if the tibia pushes forward backwards, and that could be, you know, PCL injury, you know, PCL. So that's tibia displacing posteriorly, and so that's a draw sign. You need to do that in physical examination if a patient has a sports injury and they're complaining, and you see the knee swollen, they're complaining some kind of like pain in the knee, and with the history of like being tackled on the field or something like that. And okay, so that's what PCL and ACL is: anterior cruciate ligament, posterior cruciate ligament. So that's prevent the the tibia from moving anteriorly. That's the ACL, prevention of tibia from slipping backwards. That's the PCL. And over here you have the medial collateral ligament. Medial collateral ligament is like attached to the medial meniscus, right? And that the main job of medial collateral ligament is to prevent the leg from abduction. So imagine you have an injury here, right? The lateral collateral ligament is going to pull your leg, so your leg's going to be like abducted. So basically, knock knee. Your patient will like have a knock knee, right? So that's medial collateral ligament. The lateral collateral ligament is right here, and that prevents your leg from being adducted. So your leg from being adducted like this. So basically, the collateral ligaments keep these two bones, in place, and keep these two bones, femur and the tibia, straight, right? And then you have the meniscus, which is, as I said, articular cartilage, and the meniscus is like a shock absorber. As I said, so that's medial meniscus, and that's a lateral meniscus. So these are, when you fall, when you jump, they're like shock absorbers, right? They make sure that there's no injury. They separate the femur from the tibia, and they kind of like lubrication as well. Make sure the joints are moving like freely. So once in a while, these meniscus will inject a fluid called synovial fluid into the area right here, and that will cause these two bones to move freely without like friction. So that's the meniscus, right? So what was I gonna say? So unhappy triad is when a football player or an athlete runs, right? This is in the vineyard. You can see this in the vineyard from let's say from USMLE or something. You have a football player running in the field, and he's tackled laterally. He's tackled on the side. He's tackled laterally, right? And then after a while, you see his knee is all swollen, and when you touch his knee on the medial collateral ligament, that's going to be like a lot of tenderness, right? Swollen tenderness. And when you do some imaging study, you're going to see 3 injuries. You're going to see anterior cruciate ligament tear, you're going to see a medial meniscus injury, and then you can see a tear on medial collateral ligament. So actually, the medial collateral ligament is anatomically attached to the medial meniscus. So if there is an injury to medial collateral ligament, usually the meniscus will have an injury too. So basically, an athlete gets tackled on the lateral side, anterior cruciate ligament will have a tear, medial meniscus will have an injury, and medial collateral ligament will have a tear. And that's gonna cause a lot of pain, and also the patient may have like hyperextension, because if the ACL is tear, there's a risk of hyperextension of the knee. Also, the knee will not be stable. So when the patient is running, these two bones, femur and tibia, will be slipping around. That's going to be, adduction of the leg at the knee joint, like a knock knee. So it's a sports injury, and that's something that we don't see often. But on the USMLE, on the question statement, there's something about like sports injury, something being tackled from the lateral side. Then you have to think of unhappy triad. Otherwise, on the USMLE, on the board exam, usually when they test for the knee, they test for the old people with or overweight people who has osteoarthritis. That's like wear and tear of the joints. So articular cartilage will eventually start to wear down, and the bone will start rubbing on each other, and the patient will have a lot of pain. That's osteoarthritis. But here, with unhappy triad, as I said, it's going to be injury to ACL, that's going to be injury to medial meniscus, and that's going to be an injury to medial collateral ligament from a hit on the side, from the lateral side of the knee. And as I said, ACL, that job prevent the tibia from displacing forward. PCL prevents tibia from slipping backwards, and the collateral ligament's the job is to keep these two bones, femur and the tibia, in place, in shape and straight. And the meniscus right here are the shock absorbers. And I think that's all I have for today. And I know I haven't done Facebook Live for a while, so hopefully we'll do more often. And then the next time, hopefully we can do that in Thai language. I try to excuse me, my throat's kind of hurting today. Yeah, usually I try to alternate between an English video and Thai video, and just lately I've been doing a lot of Thai videos. So today I want to do a little bit of like an English video, and I want to explain my chat that I taught some medical students this week. And again, my drawing is horrible. I know my drawing is horrible, so I have to work on that. But again, thank you for your attention today, and I always enjoy talking to you guys. I always coming on live and talking to you, and hopefully we'll do some more live in Thai next time. Swadee krap.